Aloha, Dr. Summer Nicole here of Yoga Doctors TV. I wanted to jump on and share this bit about the pelvic floor, and this is something even in physical therapy school that's really not even taught, but your pelvic floor is part of your respiratory system, so it actually mirrors the diaphragm. So as you inhale and the diaphragm goes down, the pelvic floor goes down. And as you exhale, it naturally should contract. And so kind of in our society, we're taught like, oh, the pelvic floor is weak and we need to strengthen the pelvic floor. And Kegels are often prescribed. And what happens, and I'm going to give my teacher, Angie Mueller, credit here for this analogy, but she says, if you think about the pelvic floor, you want the pelvic floor to be in the lobby. And if the pelvic floor is too tight, which is the majority of the population, the pelvic floor is hypertonic, meaning too tight, then it's instead of the pelvic floor muscles being at the lobby, then they're stuck maybe between the first and second floor. And so what happens at that point is if you're prescribed Kegels, all you're doing is contracting within that really shortened range. And whenever you're only contracting within that really shortened range, the pelvic floor, it's not fully relaxing or fully contracting, and you have a pelvic floor dysfunction. And so how the pelvic floor actually is, and your deepest core muscles, which is your pelvic floor is part of, how they're meant to contract is reflexively, meaning automatically, involuntarily. They should work for you like less than a split second before you go do like a bigger, grosser movement. Your pelvic floor muscles and your deepest abdominal muscles should turn on and stabilize your spine, stabilize your organs, and then your bigger muscles go and do your gross movements, okay? So what we're taught, and even in physical therapy school and yoga trainings, we're taught how to turn on certain muscles, like turn on the pelvic floor, turn on the transversus abdominis, the deepest abdominal muscle. We turn it on by saying lifting the pelvic floor, draw the belly to the spine, but we're doing that consciously, right? And so it's not how these muscles work. These muscles actually work reflexively. They need to turn on reflexively. So we actually need to train them in that way. We need to train them in a way that they turn on involuntarily, and we do that with breathing in a certain way. And this new method I'm studying, hypopressive breathing, actually does that. It's where you inhale laterally into the rib cage, and then as you exhale through the mouth, all the air out, you empty out the exhale, and you grow in those deeper core stabilizing muscles with a few different specific postural cues that make that happen. But that's how you want to train the pelvic floor, is reflexively like that, not consciously, not like just lifting the Kegel, and so lifting it through a Kegel. So that's actually increasing intra-abdominal pressure, and it can make any pelvic floor dysfunction worse. So if you have a prolapse or incontinence dysfunction, anything like that, that can actually contribute to making that worse, which is why I'm trying to spread this information as much as I can, because it's just newer research that's shown how we've done things in the past. It has actually been a detriment and done more damage than has done more good. And so traditional core work actually increases intra-abdominal pressure in the abdomen and in the pelvic floor, which pushes the pelvic floor pushes the pelvic organs down more, and then that weights the pelvic floor. And then when the pelvic floor is weighted, it becomes too tight, okay? And so the only way to make that pelvic floor come back into a normal tone is to unweight the pelvic organs from the pelvic floor. And so that's what this hypopressive breathing technique does. Part of it is the inhale and the exhale that I explained, and then the second piece is where you get all the air out of the lungs, and then you do like a suctioning up of the abdominal wall, not consciously, not by pulling the belly up and in, but by taking like a false inhale. You can plug your nose and then take an inhale, widen your ribs. It's like taking an inhale without taking in air, and what it does is it's called an apnea in this method, and it suctions the abdominal wall up. So it's a passive lift of a relaxed abdominal wall. Okay, so that apnea, which means when your lungs are completely emptied out at the bottom of the exhale, you can plug the nose, and then a passive lift of a relaxed abdominal wall, and that's going to lift the pelvic organs up and all of your deep core muscles, and so it's going to turn them on all at once, all together, by that breath and by that technique. and at the same time turn them on involuntarily. So you're not consciously having to lift the pelvic floor, pull the belly to the spine. In fact, you do not do any of those things. So it's the opposite of what we know a lot about pelvic floor health, and a lot of what is actually prescribed. And where this method comes from is actually Spain, and it's called low pressure fitness, which is the postural and exercises that incorporate this hypopressive breathing technique. So it's called low pressure fitness. So it's amazing for any women, preparing the body for pregnancy, any women postpartum, and anybody with women's health issues, and not only that, but for men as well. So if you're experiencing ED, anything, any kind of sexual dysfunction can be from those pelvic organs sitting low and inhibiting the arterial, the blood flow, to those organs. So it's not just good for women, but good for men as well. And so I just want to spread this information as much as I can. So just know that if you're experiencing any of those issues, that you can get better. That is the main thing, that there's a method that is really effective in lifting the pelvic organs off the pelvic floor so that you can actually unweight the pelvic floor so it stops being so tight because it's holding up the weight of your. If pregnant women are taught that, or you just think that it's too weak down there, and so you're kegling all the time and lifting the pelvic floor muscles up, and sometimes you're engaging your core, your abdominals when you're doing that too, and you're actually increasing intra-abdominal pressure, which is making it worse. And so this hypopressive breathing technique and these low pressure fitness exercises are to reduce pressure in the thoracic and the abdomen and in the pelvic cavities, so that it lifts the pelvic organs off of the pelvic floor, so that it can start to normalize resting tone of the pelvic floor and the abdominal wall. So I'm looking forward to teaching workshops all across the world, really, with this method, and physical therapists, fitness instructors, yoga teachers, yoga students, anybody that works with the core. And then I'm also taking Skype clients as well. So if you're interested, please PM me, and I would be super happy to share this information with you, because it's a total game changer for what we actually know about pelvic floor health. So I hope this is useful to you, and I hope you have a beautiful day. Aloha.